This is a like a slightly off the track discussion during your conference. I know that, but I think it's very important that we look into this very seriously, because after my work in India for about 12 years with very closely working colleagues in the field of oncology, and even after that with like good friends like Dr. Nitesh over several cases. And after coming back to WHO, looking at it from a policy perspective, availability of resources, and how to use it in the most good, in the best manner possible, and working with some organizations which are really of international like level, like the NCA and all. I think that this is some area which we cannot actually ignore anymore. Rather, it needs to be addressed and in an appropriate manner. So I would like to talk to you about the opportunities of Ayurveda and yoga in the integrative oncology. you know as a clinician in oncology, most of you have different needs, and the patients have a different need. You might have noticed that, like, you are worried about the patient having nausea and vomiting, and you are worried about whether to stop a medicine, blood cells going up and down, fatigability of the patient, alopecia, etc. Whereas the patients are more worried about reoccurrence of the disease, whether they cannot sleep well, they have pain, they think and worry, and really have side effects of medication recovery, like they are really strive to recover from chemo, radio, and RT interventions which you give. So this is almost same to what you would look at it from even from an Ayurvedic point of view, like, because in Ayurveda, cancers are classified on the basis of their site, origin, and metastasis. And like, it is also looking at the threat to life, and pain and quality of lives are real important endpoints for us. And and age and comorbidities are also something which are decisive factors for selection of drugs and therapies. This is like that. There ends the comparison, like, because then modern medicine goes into a very detailed approach, which has studied cancer quite well, and and knows exactly to the point of to the genetic component of every single treatment and the efficacy of it. uh, Ayurveda does not have that. So like, we have a broad approach to it. So how can we bring these two knowledge systems together, which can probably improve your treatment outputs, is my thought process, or had been my thought process. So one of the main areas is pain. Like, we have done a study with a lot of patients with cancer who had undergone robotic thoracic surgery for lung cancer, with my colleague and friend Dr. Ali Zamir Khan. And like, and this was published actually in the Journal of Thoracic Diseases. In fact, we found that in fact, Dr. Khan came to me with a problem. He had patients who had severe like neuropathic pain in the chest wall, which they had a lot of them, because the number of patients whom he was looking at as a surgeon was quite huge. So he had these patients who came to him with pain in the chest, and he was not able to manage it appropriately, or other than giving them a large number of, like, large quantum of, or large duration of long duration of like painkillers. So he came to me. I used to sit right across to him. He came to me and asked me, Kita, do you have something for this? So we started looking at this, and we found that some simple external therapies, which is, this is post therapy. There is no cancer treatment being done at this particular moment to the patient, like, and like, there could be chemotherapy or something which is ongoing, but definitely not radiotherapy. This is post surgery. And we have these patients, we gave external therapies, and we found that within about 7 to 8 days, we were able to bring down the pain score by, like, dramatically to almost zero, which was an excellent outcome as far as Dr. Khan was concerned, because he was off like, all these complaining patients who used to come back to him and whom he didn't have a, like, proper answer to. And whereas we had a very simple solution to it, which we further, this one we actually, this procedure, which is a very intense procedure, we actually simplified it, and we taught patients to do this at home with very simple procedure, like, And this is something which is called as uro piju, and like there are different ways of approaching it or explaining it. But we were able to manage pain. There is no internal medication, external therapy. I think we should be like people who are worried about neuropathic pain in post cancer surgery should seriously look at this as an option. Like I think that's one main area which you should be looking into. Another area which we started looking at was head and neck cancer. Like this is post radiation therapy, or like ongoing radiation therapy. And when we started doing yoga to these patients, adding yoga, and we started asking these patients how they were doing as far as quality of control, quality of life was concerned. And we found that like addition of yoga really made some difference to patients, like especially in those green boxes you can see, dry mouth and sticky saliva reduced, and like there was improved swallowing. They were not feeling as ill as others. They had better like ability to eat. I think this is another area where head and neck cancer patients, you should start yoga. And probably you should try that. This makes a lot of difference for your patients, so you should probably try that. Another area was, of course, yoga protocol in breast cancer. You can see the blue line and the red line of is before and after for illness. There's a definite benefit in ability for strenuous physical work, stamina, short walk outside the house, etc., which are all part of the EORTC QLQ330. Like this is done by the radiation therapy department independently of an Ayurvedic doctor, being part of collection of this data. So there was definitely improvement. There are hundreds of studies now published all over the globe regarding breast cancer management and improvement through yoga during the cancer treatment. So I think yoga is a major part which you should adopt into a treatment. Another area where we found very useful to the radiation therapy, like head and neck cancer patients, where management or prevention of mucositis for patients who were undergoing radiation therapy. And we found that we could manage it quite well with simple kadas, like the decoctions of simple medicines like tribala, or some other
Uh,
herbs which are very
Dr.
commonly
Geeta,
used, which all of you know. Yeah, yeah, yeah,
Dr.
yeah,
Geeta,
yeah.
I'm sorry. I think we are slightly short of time. I'll give
No
you about
problem.
a minute to conclude, and
Yeah, yeah,
then you can.
yeah, yeah. I think we were able to work on dysphagia, post radiotherapy, dryness of mouth, and then we found some benefits in like in improved nutrition, management of side effects of hormone blockade therapy. So like there were several of them, and we also thought we didn't do any of this fundamental research work, but this is something which I am right now working with several other institutions now. But quite interestingly, these are areas where we can actually look into. But main the point, which the takeaway is that you have a resource which is quite easily amenable and easily workable within the community which you are currently working on. Easily available resource, very cost effective, and very useful for your patients, at least in those patients and with whom I and my colleagues in oncology had been working. So I think I would make this as a like a point of request, or an opportunity to request all my colleagues in oncology to see whether they can include or integrate traditional medicine, whichever may be, into your oncology practice in the most appropriate manner. Thank you so much, Dr.